Hello, everybody. I am Dr. Rohit Madhav Sane. I've done my MBBS, I've done my fellowship in cardiac rehab from Apollo Hospital. And today I'm going to present a brief about evidence-based preventive cardiology practice, whatever we do in Madhavbag. If at all we just go back and try to understand the modern medicine's of cardiology, a recent publication called Times of India had mentioned that the deaths due to heart disease is slowly, gradually rising up in India. And in last 26 years, it has risen by about 34%. At the same time, we could see that the mortality due to heart disease in the year 1990, which was 15.2%, has now gradually risen till 2017 to 28%. So in spite of angioplasty, in spite of bypass surgery, in spite of aggressive medical management, we could see that there is a surge in the mortality due to coronary artery diseases in India. This gives a clear idea that the aggressive management by modern medicine has somehow not been effective in reducing down the death rate of coronary artery diseases in India, as it has been seen that in 1990 it was 15.2 and in 2017 it has risen up to 28.1%. So here comes the most important thing, that why is this organization called Madhavbag come up in the space of preventive cardiology. So just to give a brief about Madhavbag, we have more than about now 330 clinics all over the nation. We are there in Maharashtra, Madhya Pradesh, Uttar Pradesh, Gujarat, Goa, Karnataka, Delhi, Chhattisgarh, Kolkata, and so on. And we have 2 hospitals, 330 clinics, more than 450 Ayurvedic doctors are there who are practicing the science of preventive cardiology to help the patients of chronic diseases and helping them to manage their own diseases through lifestyle modification and Ayurveda. So as of now, we conduct more than 30,000 stress tests per year through these Ayurvedic doctors. More than about 1 lakh ECGs are conducted every year. More than about 3.5 lakh of OPD we cater to every year, and more than about 1.5 lakh Panchakarma is being performed every year by our doctors. So the basic question that comes up is, modern medicine, when it has been so strong, what was the necessity of Ayurveda to come up? The earlier slide has already spoken about it. And now the most important point comes up is, when I have done my allopathy, how did I come into Ayurveda? So when I have realized the strength of Ayurveda, I said that now reinventing the wheel in allopathy, it's better than to get this wheel back into Ayurveda and start my research. So when I was going through my modern studies quite a few years back, what I realized was, if at all we go into the clear classification of modern drugs, which are used, for example, in controlling hypertension or controlling diabetes, we could see that there are specific classes of medicines which have been explained in allopathy. Like, for example, if at all you talk about blood pressure management, we have calcium channel blockers, we have angiotensin converting enzyme inhibitors, and so on, medicines which help in curbing down the blood pressure. As well as in case of diabetes, we have several other classes. Like, for example, some of them are oral hypoglycemic agents, which will help to produce insulin, which will help to reduce down the insulin resistance, which will help to excrete sugar through urine, and so on. So I had a thought while reading my Ayurveda books was, these classifications, whatever has been mentioned in allopathy, can there be a same kind of classification in Ayurveda also based on the mechanism of action of these herbs? Hence, I plan to conduct an animal trial. So this animal trial that we planned was supposed to be conducted for the herbs which have been mentioned in the text for blood pressure management, for diabetes management, as well as for heart disease management. And that took me ahead with this whole research of animal trials. So the first animal trial that we conducted was on hypertension management, and wherein the herbs which have been already mentioned that somehow they must be helping in reducing down or controlling the blood pressure of our human beings. I conducted the same thing on animal trials, and this is the result that I obtained. If at all we see in this whole slide, we could see that Brahmi can be a calcium channel blocker, which has been come up as a finding in our animal trial. At the same time, Shunthi also can be a calcium channel blocker, while Vacha has exhibited as an AC inhibitor, angiotensin converting enzyme inhibitor, Vacha and Vivitaki, as well as Pippali. As well as other herbs like Punarnava and others have been shown to be diuretic. So this gave me a good insight about how should these herbs be helping our human beings to reduce down or control their blood pressure. The same way as for blood pressure, we also tried it for diabetes management. In over here, we could see that herbs like Amalaki and Haridra, as well as Gudmar, Banaba and Daruharida, there were several herbs which were trialed on the animals, but these are the few results that we came up on the slide. So the first thing, if at all you see, if at all a type 2 diabetic individual comes in, Daruharida will be a very good herb because it helps in reducing down the insulin resistance. While at the same time, if at all we are supposed to protect the beta cells as well as regenerate the beta cells, Amalaki is going to be a good option. Along with that, Gudmar, Haridra, Banaba, other herbs also typical mechanism of action, those herbs are being clearly identified in this animal trial. At the same time, when we talk about blood pressure and diabetes, we are also supposed to talk about heart disease also. So the most important thing comes in is coronary artery disease management. So we had animal trials in which we had to give a good high fat cholesterol diet to those animals to create those kind of blockages in their coronary arteries. And post conducting these high fat lipid diet to these animals, we had these herbs which were given to these animals. So we could see that the reduction in the amount of blockages in the coronary arteries of these animals was due to these herbs, and these were mainly the Amla Rasatmak herbs, which you can see enlisted over here, like Vrukshamla, Matulunga, Amlavetas, and herbs like Pushkarmul also helped us to reduce down the blockages in the coronary arteries due to its anti-inflammatory and hypolipidemic action. So as a whole, if at all we see, we try to club all these science, whatever we tried to research from these animal trials, and we coined out a simple therapy that is called as Sampurna Hriday Shuddhikaran therapies. Now this Sampurna Hriday Shuddhikaran therapies has 4 major angles. The first one that we conduct for our patients who are there in already heart disease, diabetes and blood pressure, the first thing that we conduct is the Panchkarma therapy. The second is about diet modification. The third one is aerobic exercises, and the fourth one is digital monitoring. So as a whole, these 4 pillars together, we call it as Sampurna Hriday Shuddhikaran therapies. And these therapies we normally utilize for our patients, which we see the reversal of diseases through this whole line of action. Now, the first paper through all these things that we published was on Lancet. When we talk about evidence-based Ayurveda therapies, obviously the evidence have to be published somewhere. And the first paper that we published out was in a conference that was in Lancet. And this paper clearly mentioned that the quality of life of chronic heart failure patients, a patient who is already a coronary artery disease patient and due to which the cardiomyopathy has already seeped in, and the patient is complaining of breathlessness on exertion with pedal edema with a very low quality of life. In those 695 patients, we had trialed out this Sampurna Hriday Shuddhikaran therapy, and this paper was published for the first time in the history of Lancet, and which clearly mentions the Sampurna Hriday Shuddhikaran, which is an Ayurvedic therapy, helps to improve the quality of life in chronic heart failure patients. As we mentioned these whole things in the Lancet, there were few questions which were asked about chronic heart failure patients, whether it helps to improve the 6-minute walk test in these chronic heart failure patients or not. If everybody knows that chronic heart failure patients normally do get breathless while walking by climbing up the stairs. So the American Heart Association has designed a test called a 6-minute walk test, in which the patient is supposed to ask for about 6 minutes how much ever he can walk. And during his walk, we are supposed to calculate the distance that he has walked, the MET value, the VO2 max, the heart rate, the ECG, the blood pressure. All other parameters are supposed to be calculated, on which basis we come to an inference whether this patient is into chronic heart failure or not. So as a whole, we had all these patients into our study. And when we tried out these 133 patients of chronic heart failure patients with the Samkhya Shuddhikaran therapy, we could see that yes, the 6-minute walk test of these patients improves significantly post-therapy. So this gave us a very good idea that yes, Ayurveda is actually an evidence-based medicine which can be tried out for heart patients. And this paper was published in the American Heart Association's official publication called Circulation. So this is how this was the second evidence that we tried to push to the allopathic fraternity, that yes, Ayurveda therapies help to improve the 6-minute walk test of a chronic heart failure patient. Next, they had questions. When I tried to publish this research paper, they had several questions about whether this therapy helps you to improve the ejection fraction of your heart patients or not. So if at all, you must be knowing, in case of chronic heart failure patients, there are several patients who are with heart failure reduced ejection fraction. So those patients who had ejection fraction lesser than 40% were enrolled in this study. And when we tried to analyze these patients, whether these 133 patients had improved in their ejection fraction or not, we could see that yes, 39% of ejection fraction in a span of about a month of this Samkhya Shuddhikaran therapy, we could see that the ejection fraction had increased to 45%. So this was a drastic improvement in these individuals, wherein the 6-minute walk test had also improved from 395 to 510 meters. Plus, the ejection fraction was also improved from 39 to 45% in this chronic heart failure patients. This was published in the British Journal of Medicine and Medical Research, and this gave us a very good insight that yes, allopathy also accepts these kind of research papers which are purely evidence-based. So as we went ahead, when I published this research paper in British Journal of Medicine and Medical Research, a number of cardiologists who were friends to me, they asked me several questions that yes, whether these therapies give a placebo kind of effect or these therapies actually improve the patients physically also or not. So for this, I had to conduct a randomized controlled trial. So we went ahead and conducted a randomized control trial for the first time in the history of Ayurveda services, wherein a randomized control trial was conducted for Panchkarma services. Now, this randomized control trial was conducted by the cardiologists themselves. This RCT was conducted by the cardiologist for their own patients whom they had identified as heart failure patients. As well, those patients, which criteria are they supposed to monitor and measure during the therapy as well as after the therapy, was also decided by the cardiologist, and the whole monitoring and the complete therapy set was supposed to be conducted in their hospitals itself. So as a whole, this was a clear randomized control trial where no intervention from our side was to be conducted. All the therapy kits, all the therapists were sent to their hospitals, and they conducted their own patients with heart failure. They conducted this Ayurveda therapy on them. And at the end of 18 weeks, when the analysis came out, it was very clear that this therapy has improved the heart failure patients' VO2 max by about 40% more as compared to allopathic therapy. This randomized control trial has had two different groups of patients. One group was supposed to be treated with only allopathic drugs, while the other group was supposed to be treated with allopathic drugs plus Ayurveda intervention of Panchkarma. When these two groups were compared with each other at the end of 18 weeks, the cardiologist could see that there is an improvement of 40% more as compared to only allopathic medical intervention. This Ayurveda medical intervention had an upper hand in treating this heart failure patients, and this was the paper which was published in Indian Medical Journal, Indian Heart Journal, which is an official publication of Cardiological Society of India. So the cardiologists themselves had published this research paper in their own Indian Heart Journal, and this gave us a very good thought about conducting better trials in the future. So this was the first ever RCT which was published in the Indian Heart Journal related to Ayurveda, which showed that the improvement with Ayurvedic therapy was 40% more better as compared to allopathic medical management only. As we went ahead, when we published this research paper, there were a number of cardiologists which asked us that VO2 max was a single parameter which improved. As everybody knows that VO2 max is an individual predictor of quantity of life for a heart patient. Once a patient is diagnosed with heart failure, VO2 max is the only parameter which is going to decide how much more is this heart patient supposed to stay alive. 1 ml of VO2 max improvement helps to improve 15% of survival in these patients, and thus if at all we see that 9 ml of VO2 max which was improved due to this Ayurveda therapy, that must have increased that patient's lifespan to a very good level. But this was not enough for the cardiologists. They said that if at all you have to prove it, you'll have to prove it along with VO2 max on a pathological parameter also, and the newest pathological parameter for a heart failure patient is nothing else but NT-proBNP. NT-proBNP is a parameter which is been secreted by the left atrium whenever it gets enlarged due to fluid overload. Whenever the heart is entering into any kind of heart failure, the left atrium gets expanded, it gets stretched over, and this releases NT-proBNP in the blood. And this level of NT-proBNP has to be measured for a heart failure patient. And modern medicine is striking hard to reduce down this NT-proBNP to very good efforts that they are trying to put through various different R&D efforts. But Ayurveda treatment has given us a very good insight that NT-proBNP, which was supposed to be reduced down in these heart failure patients, if at all this therapy, which is called as heart failure reversal therapy of Ayurveda, which includes the Panchkarma procedures, the diet management, the digital monitoring and exercises clubbed together, this holistic treatment helped us to reduce down the NT-proBNP from 858 to 494. That was lesser by 43% as compared to the baseline. And moreover, it was absolutely statistically significant in these patients that yes, NT-proBNP, a pathological parameter which had been secreted by the heart because of overstretching of fluid overload, absolutely the structural changes in the heart must have improved, due to which the NT-proBNP had reduced down by 43% with this Ayurveda treatment. So this was again a great evidence that we tried to publish in the modern medicine for their own parameters, that yes, Ayurvedic treatments have a clear-cut evidence-based approach in reducing down the NT-proBNP as a quality of life parameter for these patients. As we went ahead, the cardiologist also demanded for parameters of inflammation, and that is an HSCRP. If at all we could see that HSCRP is a direct parameter of inflammation, and this inflammation leads to ischemia through coronary artery disease in a heart patient. So we tried to monitor both these things, and we could see that an Ayurvedic treatment of Panchakarma, which was holistically practiced, helped us to reduce down the HSCRP, highly sensitive C reactive protein, which is an inflammatory marker in these patients. We could see that the HSCRP was reduced by 28% as compared to the baseline, and the Duke treadmill score. The Duke treadmill score is a golden parameter been evaluated for several years in various different peer-reviewed journals. You could see tags for Duke treadmill score, which is a clear parameter to estimate the ischemia of myocardium. If at all the heart is going through an ischemia, the heart is going to show some ECG changes on the ECG as well as the stress test. And a composite marker of all this, when the patient runs on the treadmill for conducting a stress test, we observe ST changes in the stress test of an ischemic patient, and a composite marker of all this is called as a Duke's treadmill score. So this Duke treadmill score also improved by 13 units, which clearly mentions that the ischemia had reduced down with the help of this Ayurvedic treatment. So as a whole, if at all anybody asks about that whether Ayurveda is about evidence-based medicine, yes, the answer is absolutely clear that even though you take a pathological parameter, even though you get a functional parameter, and even though you get a structural parameter, by all means we could show that the Ayurvedic treatment is a completely evidence-based therapy, as what you could see that in the Journal of Indian College of Cardiology, we had published this paper in which the HSCRP had reduced down by 28% from baseline, and the DTS score, the Duke treadmill score, had improved by 13 units. Now, the most important question that any cardiologist would ask was whether you could show the ischemia reduction on a myocardial perfusion imaging kind of test, which is a nuclear medicine test. It has not been practiced anywhere in smaller hospitals, but only in the bigger hospitals the nuclear medicine tests are being conducted, which is called as a myocardial perfusion imaging. So the cardiologist had asked us whether your treatment helps these heart patients to improve into structural parameter through a myocardial perfusion test or no. Hence, we conducted a clear comparative quantitative outcomes on myocardial perfusion imaging, wherein you could see that in the test over here, before the therapies that we conducted, you could see this yellow kind of yellow-orange kind of thing, which is a very good blood supply. But over here, it gets constricted at this point, wherein we have tried to circle in the before the slide. You could see this is the circled part, which clearly shows that yes, this was the ischemia which was there before the therapy that we could do. But after the therapy, we could see that the ischemia had rectified structurally. Also, we could show it on myocardial perfusion imaging. So as a whole, if at all we see that if at all this therapy is being compared with oral medical therapy of allopathy, we could see that the ischemia reduction of this allopathic oral medical therapy, the ischemia reduction is only by 3.48 units. But this Sampurna Hriday Shuddhikaran heart failure reversal therapy, offshoot ischemia reversal therapy, shows you a complete reduction of 17 units of ischemia within a span of 6 months, while the oral medical therapy reduction by 3 units of ischemia was in a time span of 18 months. So if you could just identify which therapy works more better and in a lesser amount of time, it's nothing else but Ayurveda therapy. So this has been clearly mentioned on a structural analysis of myocardial perfusion imaging, which is a nuclear medicine test, and no other test can challenge this test. And over there also, Ayurveda has completely proven that yes, the improvement has been documented on a myocardial perfusion imaging also, wherein the ischemia reduction is seen to be quite more effective as compared to allopathy treatment alone. This paper that was being done for myocardial perfusion imaging was published for the first time in the European Society of Cardiology. So this has been a very, very important milestone for the Ayurveda Panchakarma therapy to be published in European Society of Cardiology, which clearly mentions that ischemia reduction, the myocardial ischemia due to coronary artery disease, can be reduced down with Ayurveda therapy and far more better as compared to oral medical therapy alone. Now, the most important thing that I was asked when I was presenting this paper in the European Society of Cardiology at Vienna, the question that was asked to me was about reduction in the blockages, reduction in the atherosclerosis. Hence, we had to conduct a trial in which we conducted a CT angiography with volumetric assessment of the plaque, in which the total atheroma volume was supposed to be studied. So as we went ahead, we conducted this trial, and at the end of the trial, I'll directly come to the results of the trial. When this trial was supposed to be compared with statins, which was conducted in an asteroid named trial, which is readily available on the Google, anybody can go in and have a look, that this asteroid trial clearly mentions that the reduction in atheroma post asteroid trial was about 12.5 cubic millimeter, and a meta-analysis of all the statins that are being used in allopathy, all the trials which have been conducted with statins in all over allopathy, a meta-analysis of 12 randomized control trials in allopathy has clearly documented that the reduction in the plaque, reduction in the blockages in the coronary artery could happen to about 12.5 cubic millimeter to 20.87 cubic millimeter was the maximum reduction of atheroma volume that was observed with statins for about 18 months that the patients were supposed to consume. So our therapy, the Ayurveda therapy, with the diet, with the exercises, and the Ayurvedic Panchakarma therapy, with the digital monitoring, we could show a direct comparative effect of Madhavak therapy versus statins. So in the 18 months of statin consumption, where the earlier the plaque size, which was 451 cubic millimeter before the statins were started, post statin after 18 months, 1.5 years of statin consumption by these patients, we could see that the plaque size had reduced from 451 cubic millimeter to 439 cubic millimeter. That was on an average 12.5 cubic millimeter plaque reduction was observed in 18 months of the statin therapy in allopathy, which has been published in Asteroid trial. While the Madhavak therapy of 8 weeks of Madhavak therapy, the plaque volume, which was 462 cubic millimeter to start with at baseline, at the end of 8 weeks, we could see that the plaque volume had reduced down to 367 cubic millimeter, and thus the total reduction of plaque volume was 95 cubic millimeter in a span of 8 weeks only, as compared to 12.5 cubic millimeter in a span of 18 months of statin. So you could see the before and after images in the coronary arteries over here, that you could see the encircled part, the blockages in the coronary artery. After 2 months, you could see the reduction in the plaque in the encircled part of the coronary artery, which clearly mentions that the blockage reduction can be evidenced by Ayurveda therapy in a matter of 2 to 8 weeks also. So this paper was published as a case study in Journal of Cardiovascular Diseases and Diagnosis, and thus we entered into a long-term survival benefit of Ayurveda therapy for about 4 years. So if at all we try to compare the oral medical therapy, we try to compare the oral medical therapy plus angioplasty versus Ayurveda therapy for 4 years of mortality benefit, it has been clearly documented in various research papers that only oral medical therapy of allopathy, if at all the heart patients continue for about 4 years, there would be about 19.5% of mortality in these patients post 4 years of only oral medical therapy of allopathy. While if at all the patients are on oral medical therapy plus angioplasty, there is no great change in the mortality ratio. It was 19.5 earlier, it is 20% in 4 years on this allopathic treatment. But with Ayurvedic treatment, mortality over 4 years has reduced down to only 13%. So this is a clear long-term survival benefit which can be given to our patients through Ayurveda therapy. And this was again published in the Journal of Cardiovascular Diseases and Diagnosis, that the patients can be seen improving in their heart diseases very well with the help of Ayurveda. So at the end, what I would like to present as a final message is the fusion of modern science investigations and practices of Ayurveda therapy. If they're fused with each other, the actual interpathy or else the actual integration of these two sciences come together and integrate with each other through modern investigations and Ayurveda therapy, I am sure that this will be a great boon for the mankind, which is going to help us to reduce down the burden of heart disease in India. So this fusion of having modern science investigations and Ayurveda therapies with each other, integrating with each other, is nothing else but the organization that is Madhavbag. So at the end, I would just like to highlight the mission of Madhavbag. Our mission is very clear, is to empower the Ayurveda doctors through well-researched innovative therapies based on Ayurveda and modern diagnostics to reduce down the incidence of premature deaths due to cardiovascular diseases. So that's all for me. And one thing I would like to be absolutely clear, that when I was into my modern medicine and I used to go through a number of researches, I used to wonder whether Ayurveda has that kind of evidence-based approach or not. So it was my job to take it ahead. I went through all these challenges and tried to prove the Ayurveda therapies on modern parameters, and there is where the whole success lies, in integration of both these sciences. So that's all from my side. Thank you very much.